The following program is sponsored by Southwest Pain Group and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.
Hello and welcome to Ask the Doctor. I'm your host, Mike Berger. Here to answer your questions on pain management and alternative pain management today is Dr. Robert Bulger from the Southwest Pain Group. Southwest's mission is to care for patients who suffer from chronic and acute pain. The Southwest Pain Group is actively involved in the care of patients who suffer with pain issues. Just call the number that you see on your screen. It's 1-888-572-4411. Or you can go to the website, www.southwestpaingroup.com. Dr. Bulger, a lot of my friends suffer from chronic neck pain. And tell us a little bit about that. Is there something that causes that? Is age relevant to that problem?
Probably the most common cause, Mike, of neck pain is degenerative disc disease. In fact, in patients over the age of probably 30, all of us have a degenerative disc. It's just a matter of time. And it's basically a dehydration of the disc. But other common causes of neck pain would include facet symptoms. Facet joints are special joints in the neck that are gliding joints that can become arthritic with age and time. But a lot of times it's just musculoskeletal. It's just simply a muscle pull or something we've done in the garden or sports.
A lot of times, is surgery the only thing that can help or cure that, or are there alternatives?
Well, that's a pretty open-ended question. The fact of the matter is that only about 5% of spine problems require surgery. The other 95% can be solved with conservative care. Things like therapy, chiropractic, physical therapy, exercise, sometimes injections, medications, and often, though, it's just a matter of lifestyle modification, identifying what's causing the problem and then trying to fix it.
You know, I've talked to a number of people who've had different types of back problems. Some doctors have told them that surgery would help them. And then I've heard from a lot of people who say, don't have an operation on your spine or on your back unless it's absolutely necessary.
Well, I think part of the reason that people have a fear about surgery is that perhaps in the past, surgery was offered perhaps too quickly. But I think now, particularly in the last 5-8 years, there's a real emphasis on what we call evidence-based medicine. Mm-hmm. And spine surgeons, and we're fortunate in Dallas-Fort Worth, we have great spine surgeons in this town, some of the best. And they're really tuned into this. They really want to identify the people that will benefit from surgery. So it's less of a problem, but I think in the past, perhaps there was more surgery than needed. And unfortunately, sometimes, even though the surgery may be technically successful, people may still have some pain afterwards.
Okay, Dr. Bulger, we've got a lot of great things to talk about today, so let's get to our first question. Just a reminder, you can call the number you see on the screen. It's 1-888-572-4411, or you can go to the website at www.southwestpaingroup.com. The phone lines are open, so let's start out with Margaret. Margaret's in Allen, and Margaret, what is your question?
Yes, I would like to know, I have nerve damage all down my right side, my waist down, and the pain is so severe. And they're trying right now to see about working with it with, well, I've been taking therapy and that doesn't work. And they said they could maybe go in there and do something to my back. And I don't know what they're really talking about, but I'd like your opinion. Do you think that since it's nerve damage and you know they cannot do anything about it, do you think I ought to just let it alone? Or what? No medicine helps it, nothing helps it. It's just, I cry a lot.
Well, Margaret, that's a very, very good question, and it addresses many things. First of all, we need to find out why you have nerve damage. Why does she hurt? Because there are treatments for nerve damage. What's the damage from? Is it from the prior surgery? Is it ongoing? There are medications that can help that. There are treatments. Mm-hmm. And she said therapy. I don't know whether it was physical therapy or what was involved there. But Margaret, there are medications and treatments for you. But the first thing is diagnosis. And you need to come visit us and let us get to the bottom of why you're hurting.
And I think it's so important when people do come to see you because we're laymen. We don't understand what you know, or we don't understand the terms and everything. So you've got to talk to that doctor. You've got to say, wait a minute. Explain it to me so I'll understand it. That's so important.
And there's no substitute for physical examination and face-to-face evaluation.
All right, the phone lines are open. If you aren't able to get through, you can keep trying. Dorothy's with us from Irving. Dorothy, go ahead.
Yes, I've had 2 back surgeries, and the doctor took out too much bone in my back, and they say I need a rod in my back, but they won't do it because it says they take it too long and I live by myself. Is there anything else that can be done for this? Because I'm in constant pain throughout my whole body. Thank you.
Well, you're very welcome. This is an important question. You have to be careful here, because if in fact you have too much bone out, that might mean you're unstable. If your spine is unstable, you probably do need to have that stabilized. And oftentimes the only way to stabilize an unstable spine is with some kind of supportive corrective surgery. And you really are going to have to rely on your surgeon. And we have great ones here. You might want to get a second opinion. Most top surgeons are welcome second opinions. And in fact, insurance companies require it. Because, Margaret, I think it'd be very important not to put this off. If you're in constant pain, you may need that surgery. So there are times surgery is necessary, and this might be one of those.
Great questions, good answers, Dr. Bolger. We're going to take a short break. When we come back, we'll be discussing the benefits of pain mapping. Stay with us.